Hello, my lovely friends. So, welcome back on my YouTube channel. So, once again, we are coming back with the new videos, and in this video, we will discuss about the nephrotic and the nephritic syndrome, which is the very important topic for your exam point of view. So, let's discuss what is the nephrotic syndrome, what is the nephritic syndrome, एंड व्हाट इज देयर कॉजेस कि वो कैसे होते हैं, क्या उनमें ट्रीटमेंट कर सकते हैं, व्हाट आर द इन्वेस्टिगेशन, एवरीथिंग वी आर गोइंग टू डिस्कस in this short video so that you can have a brief idea about this both the syndrome and you can never do the mistakes because the most of the time जो word है nephrotic and the nephritic guys it looks similar and the most of the student they gets confused between both these words. So now with this video I would like to make a proper crystal clear concept in your mind and you will never forget about this nephrotic and nephritic syndrome conditions. So let's begin. So let's talk first of all the nephrotic syndrome. देखिए बेटा, what is the nephrotic syndrome? Nephrotic syndrome, it is actually due to the increased glomerular permeability due to any condition like the minimal change disease or anything, and this can lead to the massive protein loss in the urine. तो बेटा एक बात हमेशा याद रखना, नेफ्रोटिक के अंदर पे मेनली प्रोटीन का लॉस होता है और नेफ्राइटिक के अंदर पे मेनली आरबीसी का लॉस होता है, राइट. सो दिस इज द फर्स्ट की डिफरेंस व्हिच यू हैव टू बी रिमेंबर टू डिफरेंशिएट बिटवीन नेफ्रोटिक एंड द नेफ्राइटिक सिंड्रोम. तो दोबारा बात करते हैं, नेफ्रोटिक के अंदर पे प्रोटीन लॉस एंड नेफ्राइटिक के अंदर पे देयर विल बी द आरबीसी लॉस, राइट. नाउ सो दिस इज द नेफ्रोटिक सिंड्रोम और नेफ्रोटिक सिंड्रोम के अंदर पे वी नो दैट देयर इज द मैसिव प्रोटीन लॉस इन यूरिन, right? Massive protein loss in urine. So we know that we are having the two kidneys. The function is to do the filtration of the waste product which is actually present into the blood. So blood carries this, the vessel carries this blood into the kidney and kidneys actually do the filtration. So whenever at the site of filtration, this site of filtration is actually the glomerulus. So you can see this is the glomerulus. Guys, actually ये है छलनी आपकी, और जब इस छलनी के अंदर पे कोई भी दिक्कत होती है गाइस, द substance which should not come out at this area, they start to coming out from this area into this renal tubules, right, or in the Bowman capsule. In this condition we are going to lose those substance which ideally should not be. So this is the condition जब glomerulus से the protein start coming up into the renal tubule. This condition we called as nephrotic syndrome, right? Nephrotic syndrome. So what is the diagnostic criteria? How we can identify whether it is the nephrotic or the nephritic syndrome? Guys, please pay attention. Nephrotic syndrome diagnostic criteria is that there should be massive protein loss, and this protein loss more than 3.5 gram per day. So if this protein start to coming up into the urine, जब urine में protein आएगा, guys, this condition we called as proteinuria. Guys, if the protein is coming out into the urine, what will be the level of protein in the blood? This level of the protein in the blood is going to be decreased, and this is condition we call as hypo. And most common protein which actually loses in the urine, that is your albumin. So that is your albumin. So guys, if albumin urine से बाहर आ रहा है, this albumin level drops down into the blood, and this condition we called as hypoalbuminemia. So this is how the hypoalbuminemia can be occurs, and this albumin if we are losing, guys, albumin का काम है to maintain the oncotic pressure, it basically maintain the oncotic pressure, and this oncotic pressure is actually loves the water, basically it attracts the water. So guys, what will be happening if the albumin level is less in the blood? The oncotic pressure will also be decreased, so water start coming out from the vessel, and this can lead to the edema. So the another feature of this nephrotic syndrome is your edema. So this is your edema. And now as a compensation from the liver, guys, when the albumin level is less, as a compensation from the liver will increase the lipid part, and this can lead to the hyperlipidemia, right? So the diagnostic criteria for nephrotic syndrome: proteinuria, which should be more than 3.5 gram per day, hypoalbuminemia, edema and the hyperlipidemia. And what is the condition of the nephrotic syndrome? What is happening? हो क्या रहा है? There is the massive protein loss in the urine, and this massive protein loss is actually can lead to the decreased plasma oncotic pressure, right? And this can lead to the edema, as just now we discussed. And liver compensation can lead to increased lipoprotein synthesis, leading to hyperlipidemia. So now let's talk about the clinical feature. तो अगर ये बच्चे में हो गया, तो guys, what are the clinical feature you can see in this baby? So as you can see in this picture to this baby, you can easily see that there are the swelling around the eye area, and guys, around the eye area swelling, surrounding area को अपन बोलते हैं peri. So this is we called as periorbital swelling. Another one, you can see there is a generalized edema. पूरी बॉडी के अंदर एडिमा हो रखा है, तो पूरी बॉडी के अंदर स्वेलिंग हो रखी है. And guys, this complete generalized edema we known as a anasarca, right? What we call this? We call this is the anasarca. So you can see the clinical feature. First of all, there is the massive proteinuria, and what is the limit value? More than 3.5 gram per day. Generalized edema we called as anasarca, and periorbital swelling. And also when this baby will urinate, जब ये baby आपका urine pass करेगा, this urine will come like the surf excel, like it's become the frothy urine. आपको ऐसे झाग झाग से दिखेंगे उसके अंदर से, right? So this is how the baby will also show the frothy urine. Now we just now discussed the hyperlipidemia you can see, and this hyperlipidemia can lead to the lipiduria. So the fatty cast, guys, very important part. This is the question which you have to be remember. The fatty cast is the clinical feature of nephrotic syndrome, and oval fat bodies can be seen. So what are the causes of this nephrotic syndrome? होता क्यों है ये, right? So there are two causes. Number one we call as primary, and another one is the secondary. Guys, please pay attention. If the MCQ is asking what is the primary cause in children, then the primary cause in children is MCD, minimal change disease, right? But in adults it is FSG, focal segmental glomerulosclerosis, right? And also there could be the membranous neuropathy. If we'll talk about the secondary, the most important is diabetic neuropathy, and then the SLE or amyloidosis, right? Now coming to the urine finding. So just now I told you, in the urine when you will see, there will be the fatty cast. Very important MCQ. आपको MCQ के अंदर देंगे. The examiner will give you that there are the fatty cast, generalized edema, protein loss is there. What could be the most probable diagnosis? Answer should be nephrotic syndrome. So guys, what you have to remember about the nephrotic syndrome? In urine, you will see the fatty cast. So in urinary cast, if we talk about, अगर इसके अपन बात करें तो माइक्रोस्कोप के ऊपर there are the different type of cast is actually you can see. Like most important cast you have to be remember, that is RBC cast, which can be seen in glomerulonephritis, like in the nephritic syndrome, and the fatty cast, it can be seen in the nephrotic syndrome, right? So this fatty cast is the clinical feature, very important feature in urine finding in nephrotic syndrome. Guys, what is the complications? Complication is infection. These babies will be have to more prone to infection because they are losing the immunoglobulins, right? So basically the baby is going to be the less immune power. Also there is the hypercoagulability because this person will also lose the antithrombin 3. Antithrombin 3, very important. This is also very important, guys. Please pay attention. Antithrombin 3, and this loss of antithrombin 3 can lead to the renal vein thrombosis, right? Now talking about the investigation. In investigation, you can do the multiple investigation part, like the urine investigation, blood investigation, biopsy, all of you can do. So whenever you are doing the urine investigation, in urine routine microscopic, what you can see, there will be the massive proteinuria and the fatty cast you will see. In blood test, you will see the serum albumin level will be low and lipid profile will be increased. And also in renal function test, you will see the high urea and the creatinine level because kidney is not properly filtrating that part. Now that 24-hour urinary protein we have to be checked, and it confirms the heavy protein loss. So you have to be remember, this is very important investigation, 24-hour urinary protein, right? And if there is nothing is clear, still you are not clear that what is the main cause, then you can do the renal biopsy. तो लास्ट में अगर आपको कुछ भी समझ नहीं आ रहा, आपने सारे टेस्ट करे, आपको फिर भी समझ नहीं आ रहा है कि क्या हो सकता है, then there could be the last area where you can do the test, that is your renal biopsy, right? Now talking about the renal treatment, nephrotic syndrome treatment part, guys, first of all, if there is the edema, अगर किसी को edema है तो आप उसको नमक ज्यादा खिलाओगे या कम? Obviously you will give the less salt, so salt intake will be decreased, salt restriction will be there, so edema cannot be become more, right? And you will do the fluid balance. Number 2, जो extra water body के अंदर है, you have to remove this water. So for removing this water, you have to give the diuretic, and the most common diuretic which you have to give, that is furosemide, right? Furosemide. So this you will be give to lose the water. And also you will give the ACE inhibitor, right, to decrease the proteinuria, right? ACE inhibitors. And now identify the cause and try to treat the underlying cause. Like if the minimal change disease is there, give the steroids like the prednisolone. And if the person is diabetic, then do the glucose control. You can also give the statins. You can also give the statins for the hyperlipidemia, right? This statin like the atorvastatin, right guys? We used to give atorvastatin. So this is the statin you can also have to give for the hyperlipidemia and anticoagulation if thrombosis, renal vein thrombosis risk is there. So this is the treatment part of the nephrotic syndrome. So let's begin the another syndrome, that is your nephritic syndrome. Guys, if we'll talk about the nephritic syndrome, in nephritic syndrome, this is actually the leakage of the RBC. And whenever the leakage of RBC is happening, the GFR will be reduced. So this is happening due to glomerular inflammation, right? So if whenever due to any bacterial condition, there is the inflammation in the glomerulus, that can lead to the damage of glomerulus and leading to leakage of the RBC, and GFR will be reduced. And this condition we called as nephritic syndrome. Guys, आप मेरे को बताइए, अगर यूरिन के अंदर पे RBC आएगी, what will be the color of urine? The urine will become like this, right? And this condition we called as hematuria, right? Hematuria. So, right? So, you can see over here, this is your normal kidney and this is your normal color of the urine. But if there is an inflammation of the glomerulus, the hematuria is occurs and you can see the color of the urine, right? So, dark color urine will start coming up. Guys, what is the classical feature of the nephrotic syndrome? If we'll talk about the classical feature of the nephrotic syndrome, guys, there will be hematuria, very, very important part. There will be hypertension. There will be oliguria and mild proteinuria and plus azotemia. What is the meaning of the azotemia? When there is an accumulation of nitrogenous product like the urea, creatinine more in the blood, we call as azotemia, right? So classical feature of the nephritic syndrome, that is हेमेचूरिया, हाइपरटेंशन, ओलिगोयूरिया एंड माइल्ड प्रोटीनूरिया. बेटा नेफ्रोटिक सिंड्रोम में क्या हो रहा था गाइस? नेफ्रोटिक सिंड्रोम में देयर विल बी द पॉलीयूरिया, राइट? देयर इज द इंक्रीज जीएफआर, देयर इज नो हाइपरटेंशन, राइट? बीपी वाज नॉर्मल, देयर वाज एडिमा, no hematuria was there, and there was the massive proteinuria. But in nephritic syndrome, hematuria but mild proteinuria and hypertension. What is the pathophysiology? That is the inflammation leading to decreased GFR and salt and water retention leading to hypertension, right? So this is the key features of the nephrotic syndrome. What is the clinical feature? Thus now we discuss the urine. You can see this is the cola or cola color urine or the smoky urine. You will see in the urine the RBC cast. बेटा नेफ्रोटिक सिंड्रोम में आपको कौन सी दिख रही थी? फैटी कास्ट. कौन सी दिख रही थी? फैटी कास्ट, राइट? और यहां पे कौन सी दिख रही है? आरबीसी कास्ट. वेरी वेरी इंपॉर्टेंट फीचर. नाउ द नेक्स्ट वर्ड, माइल्ड प्रोटीनूरिया. देयर वाज द प्रोटीनूरिया मोर देन 3.5 ग्राम पर डे, बट हियर इट इज लेस देन 3.5 ग्राम पर डे. ओलिगूरिया, hypertension and periorbital edema, same like the nephrotic syndrome. So what is the differentiating between the nephrotic and nephritic? In nephrotic there is the fatty cast, in nephritic that is the RBC cast. In nephrotic, massive proteinuria. In nephritic, mild proteinuria. In nephrotic, no hematuria. In nephritic, hematuria. And in nephrotic, normal BP, and in nephritic there is a high BP, hypertension. What is the cause of this nephrotic syndrome? This is the post-streptococcal glomerulonephritis, and this is the most common cause. This is the most common cause. Also, there could be the IgA nephropathy like the Berger disease and the rapidly progressive glomerulonephritis or the lupus nephritis, right? So MCQ will come with the history of there is the sore throat or something like this, means the person will give you the history of the infection and you should identify this is the streptococcal infection and can also affect the kidney area, right? What is the urine finding? In the urine you will see the RBC cast. That is the hallmark sign of nephritic syndrome, right? Nephritic syndrome. Fatty cast, hallmark sign for the nephrotic syndrome. So in investigation, you will do again the same urine examination, blood test, complement level like the C3, C4 and ESO titer or renal biopsy. In urine examination, you will see the hematuria like the smoky urine, RBC cast and the mild proteinuria. In blood test, you will see that agitemia, that is high urea plus creatinine and serum electrolytes. In complement level like C3, guys, C3 is actually a protein which helps in the immunity. So the level of C3 will be decreased due to the inflammation, right? In post-streptococcal glomerulonephritis. And you have to also check the ASO titer. ASO titer अपने को बताता है about the antibodies count, right? About the antibodies count. So it is positive in the post-streptococcal glomerulonephritis. And if anything is not able to find up, guys, you can do the renal biopsy. So last के अंदर आप उसमें से कुछ टुकड़ा निकालो and then you can check it by your own, right? So this is how we can do the renal biopsy. Talking about the treatment plan, guys, the same like the nephrotic. First of all, you have to decrease the salt intake and decrease the water. Number next, control the hypertension by giving the antihypertensive drug. And same like the nephrotic, you have to give the diuretic to lose the water to control the BP, like you have to give the furosemide and treat the underlying cause. Like for the post-streptococcal glomerulonephritis, if there is a bacterial infection, you have to give the antibiotic, and if there is an autoimmune condition, you have to give the steroids. And if still the renal failure is there, guys, you have to do the dialysis. So this is the treatment plan of the nephrotic syndrome. So let's summarize both the condition. Just now we discussed the main defect in the nephrotic, that is increase the permeability, but in nephritic, that is the inflammation. Proteinuria in nephrotic, that is massive, but in nephritic there is a mild proteinuria. Hematuria in nephrotic, that is rare, but in nephritic it is severe or present. In nephrotic you will see the fatty cast, and in nephritic you will see the RBC cast. In nephrotic there is the severe generalized edema, we call as anasarca, and in nephritic there is a mild edema. If we'll talk about the BP in nephrotic, it is usually normal. In nephritic there is a high BP, and if we'll talk about the urine output, the oliguria is less common in nephrotic, but in nephritic it is more common, right? So these are the key features which you have to be remembered, and this is the way you can easily remember both this syndrome condition, guys. So I hope now you can easily get an idea about both these syndrome. If any MCQ comes in any examination, you won't do the mistakes. So let's practice few MCQ and let's make crystal clear concept in your mind, right, guys? So first of all, the question is 7-year-old child present with the facial puffiness, means the periorbital edema, generalized edema, anasarca, and the frothy urine. Urine examination shows massive proteinuria and oval fat bodies. Guys, what is the most likely diagnosis? Just now we discussed massive proteinuria, facial puffiness, generalized edema, frothy urine is the key feature of, nephrotic syndrome. So the right answer of this MCQ, that is nephrotic syndrome. If it was the nephritic syndrome, then there was that less proteinuria, there was the hematuria, right? Coming to the next MCQ. An 8-year-old boy develops cola-colored urine, facial puffiness and hypertension 2 weeks after sore throat infection. Urine microscopy shows RBC cast, most likely diagnosis. Guys, everything is given in the MCQ. You can see cola color urine, hypertension, RBC cast, and sore throat means some bacterial condition is there. Guys, this is nothing. This is your nephrotic syndrome, right? Nephrotic syndrome. But this nephrotic syndrome is better. You can say that this is the post-streptococcal glomerulonephritis. Post-streptococcal glomerulonephritis. Now, the next is this is your nephritic syndrome, right? So this is post-streptococcal glomerulonephritis or the nephritic syndrome. A patient presents with the hypertension, oliguria, smoky urine, and mild proteinuria. Urine examination is most likely to reveal, guys, mild proteinuria, smoky or cola color urine, oliguria, and hypertension. This is the clear-cut case of the nephritic syndrome. नेफ्राइटिक सिंड्रोम. अगर ये नेफ्रोटिक होता तो सीवियर प्रोटीनूरिया होता एंड नो ओलिगुरिया वाज देयर और बीपी वाज नॉर्मल, बट there is BP is high, oliguria is there, and mild proteinuria is there. That is the case of nephritic syndrome, and nephritic syndrome shows you the RBC cast. Guys, the fatty cast is the feature of nephrotic syndrome. RBC cast is the feature of nephritic syndrome. Next question. A patient with massive edema and proteinuria develops renal vein thrombosis. Loss of which factor in urine is responsible? Guys, we just discussed that if there is a chance of renal vein thrombosis, this is due to the deficiency of antithrombin 3, right? Antithrombin 3. So the right answer of this MCQ, it is C. So guys, this is all about the nephrotic and the nephritic syndrome. In a very short manner, you can easily make your concept. I hope now onwards you won't do any mistakes. So if you like this video, kindly like it, share it, and subscribe this channel to get the more similar videos to make the more crystal concept in your mind. So this is all from this video. Thank you guys. Thank you very much.